Hello, I'm Ryan Ferdyhert with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. What do we owe to others, and how far does that obligation extend? Medical ethics can often be viewed as a direct relationship between patient and provider. What is the professional obligation of the provider? What rights do the patient have? This approach can make healthcare seem overly transactional in its relationship, which can take away from the deeper goals of the humanity. When we treat or provide for patients, we go into a relationship with that person, a relationship that holds deeper responsibilities that might be seen to extend beyond the individual patient. These can become complicated and challenging, knowing how far these responsibilities reach. I can remember an ethics consult that I led that touched on these ideas. Mrs. Garritson was an 88-year-old patient suffering from end-stage dementia, multisystem organ failure, and her having end-stage renal disease and lung failure. She was receiving very aggressive medical interventions, including ventilator support and pressors, but these were failing. Nephrology said that she would require continuous dialysis, but pulmonology said that that was not possible because it would require her sitting up in the bed and that would cause her lungs to collapse. All of this, and her weight had dropped to around 70 pounds. In addition, several family members had said that she would not want all of this done, that she had often said that she would not want to suffer or linger and would rather pass peacefully. Despite all of this and her frail state, her family insisted that she remain full code status, meaning that if her heart stops, she would receive full aggressive resuscitation. The medical team explained that resuscitation would likely not be successful and that it seemed not in line with her goals and preferences and would only do further harm and not actually save her life. But the family remained firm, so ethics was asked to consult. We met with the family and asked them some meaningful questions. What did she enjoy about life? Why did she not want to be resuscitated and why they felt that she would want to be? The oldest son, Mr. Garritson, said that he understands that she is dying and that she would not want all this, but that Sunday was Mother's Day and everybody wanted to have one more Mother's Day with her. We explained that she likely would not be able to survive until Sunday, but that Mother's Day could be any day. Mr. Garritson grabbed onto that immediately and said, if we could hold off removal of life support for a day or two, he could make that day Mother's Day. The team in ethics felt that that was understandable. The next day, countless family members came and visited with Mrs. Garrison and had a heartfelt Mother's Day with her. The following day, life support was removed and she passed peacefully. Modern medicine is beyond impressive in terms of what people are able to do. The extraordinary can quickly become routine. We can do so many things for patients, but that makes it extra important to uphold the humanistic values of medicine. In my mind, these include empathy and compassion. It was one thing to know what was right for Mrs. Garrison. It was another level of understanding to know how to support her family in that decision making. This family was hoping for another Mother's Day together to show their loved one how much she meant to all of them before she eventually died. This situation demonstrates the importance of keeping empathy at the forefront of patient care because we are not treating diseases, we are treating people. Thank you. I'm Ryan Ferdyhert with the Center for Practical Bioethics, and this was the Clinical Ethics Corner.